It's unusual for us to see a patient like after the first 1 or 2 seizures. In fact, the analysis we did showed that only 11% of patients presented within 6 months of their seizures. The majority present much, much later, and the average delay is about 6 years. So the typical patient would be somebody who has been having epileptic seizures, and they have been taken to the traditional healer. They would have had either concoctions to drink, they may have had some scarification, maybe some medication, some topical medication to rub. Some of them may have gone to churches or faith healers to try to treat them. And then eventually they'll come to us.
This one will tell you now, but good morning, sir. Now, general one, we will tell you now, you know, for smoke cigarette where you get this sick. You know, for shampoo where you get this sick. You know, for drink alcohol where you get this sick. You know, for total load in the head where you get this sick.
Epilepsy is a difficult, let me say, disease, really, when it's in the tooth. Because from when I was a young baby, I don't have this problem. My mother told me that I fell down from the cot bed, so I ate up the brain. So from that time, this problem is occurring.
Epilepsy, I've been from 14 years now. I've had epilepsy. So it took me so much place, like the traditional way. Going to Kabbalah, they give me kerosene to drink. So that is the way how to treat epilepsy. So I've been there for 3 years in Kabbalah, having this treatment. People are laughing at me. They say I'm crazy.
But one problem I do have, that I will confess it, that spirit of sleeping at times. I do not have that spirit of sleeping. I don't know why. So because of sleeping, it's causing a problem at times for me to have this attack. I will show an example like this problem now.
Sierra Leone is very, very short of health workers, particularly doctors and registered nurses. So there has been a lot of task shifting. Even the ministry is doing that. So they are training paramedical staff. Community health officers are really the mainstay of that, because these are people who are highly trained. They are not doctors, but they all have good secondary school education, and then they have a 4-year course on various aspects of medicine, including practical details. And as I said, some of them are now even being trained in basic surgical techniques. So these are the people who man some of the peripheral health units and some of the smaller hospitals in the various districts. The peripheral health unit, it's really the basic health facility in the country, and it's usually around village or chiefdom level. And the staff that run the peripheral health units are junior health staff with basic health training. Part of the project is to train peripheral health unit workers in all 13 districts in Sierra Leone.
Epilepsy should stop their epilepsy medication. Some patients may require more than one medication for seizure control. Some patients may need...
So Moyamba was the 10th district that we've been to, and it's usually a one-day training, and we select PHU workers from every chiefdom in the district. There are 14 chiefdoms in Moyamba district, so each one of those chiefdoms was represented, some by 1, some by 2 peripheral health unit staff. And in addition, there were also some staff from the main hospital in Moyamba, and other social workers and non-medical people involved in the training.
From 18 to 25.
We get them all in, and we go through a program which covers the social aspect of epilepsy. It covers the clinical aspect. We look at epilepsy in relationship to women issues, gender issues. We look at epilepsy in relationship to pregnancy, how patients, are managed during pregnancy, patients with epilepsy. And we also get the epilepsy social worker who is in the district, in this case Moyamba district, to give us a talk about what they have been doing in the district. We start off with like a pre-test to see what sort of knowledge they have in epilepsy, and then after the training we do a post-test, and invariably there is significant improvement in knowledge between the pre-test and post-test.
I'm here because I have 6 children in the children's home with epilepsy. So I'm here to learn more so that I can know, I'll understand how to handle them, and not only them, but other people with epilepsy within the community. There's a lot of new things I learned today, and I'm sure there are thousands of people out there who do not understand, everything about epilepsy. So if they should have this sort of training, it will be very good for them. So more people should come on board. Looking after children with epilepsy takes a lot of patience, because you have to always keep an eye on them, so that they don't have the seizures in the wrong place and dangerous places. So it takes a lot of patience. You have to even talk to the class teachers, to talk to other friends around them to understand, so that they know in case there is a seizure, what to do. I have not done a workshop or a training on epilepsy. Even during my training, that was just brief. But really to have an actual training is today. The beliefs of our native people, they have their own beliefs that epilepsy is a demonic thing. You should not go near a patient that has epilepsy, and even the saliva is dangerous and all those sort of things. If the patient has an attack, everybody will run away from that particular patient. But now I've learned that epilepsy is less dangerous. In fact, that's why I'm really happy to be here, and really I gain a lot of knowledge, because as a training coordinator, if it starts from the school, if you start teaching the students, the nurses about epilepsy, it goes a long way, and even when they get to their centers, they know, the pros and cons. They know these are the signs and symptoms. They know how to treat a patient. They will not run away from an epileptic patient. So I really have to teach them very well.
Well, this is one of our greatest challenges, to get the community, the population aware of what epilepsy is, and to dispel long-held knowledge and practices about what epilepsy is and how to manage it. And this goes back centuries, so really we're not going to do this overnight. So what we're doing is to put out basic facts about epilepsy, and epilepsy is a medical illness, number one, because a lot of people do not believe that epilepsy is a medical illness. They believe it's due to demons, it's due to witchcraft, and that sort of thing. And of course, when you hold that belief, it means that you're not going to access the clinical services that are available. So it's very important to change their attitude in terms of their concept of what epilepsy is.
I'm here today to learn more about epilepsy that has been interpreted by our community people negatively. I'm responsible for the 14 children in this Moyamba district. I will be going to the communities, to the chiefdoms, to mobilize the opinion leaders, CBOs, that is community based organizations, group heads, and all teachers, children, to disseminate this message and in fact train the children or train the teachers so as to train the children on this.
Detect abnormal electrical activity in brain. True. Patients with uncontrolled seizures must not drive or ride bikes. True. So all those who are 20 over 20, answer.
Big one. Big one. Bloody, I tell you for stop now.
We have been using government facilities. All our clinics are usually held in government hospitals, and we've been training and using government staff. So the program is already within the Ministry of Health service delivery. It's not separate. The present Chief Medical Officer, Dr. Brian McCargbo, has been very cooperative, and he has actually selected a member of staff, the Ministry of Health, to be the focal point for epilepsy in the ministry. So that's a big difference, because it means that there's somebody within the ministry now that is overseeing the epilepsy program. And then there are plans now on the way to get epilepsy added to the health information systems so that they'll be able to start collecting data on epilepsy in various regions in Sierra Leone.
Okay. Absent seizure. So you had a spike wave.
When we have this in radio, they told me that epilepsy is not the way how to treat it in traditional way. So we come to English way. So they told me that Dr. Lips is the doctor who will have to give the treatment. So we come to Dr. Lips. So after that we go to Brother Max. Brother Max has to show me this way that the medicine is there. So I began to take Phenobab. So they give me Phenobab for some time. So I took Phenobab for 6 years. I didn't have any another way that I will have to fall down. So I thank God in that way.
That has really kick-started the epilepsy program. And it will certainly, evolve into hopefully a stage of continuity. But we still need a lot of support. But the future really is for the government to take this over, to come more on board. And there are signs that they're doing that. So I think with time, the Ministry of Health will gradually take over, and epilepsy will just be just another illness within the Ministry of Health. It doesn't have to be something that's special.
So this and his team, that's a very useful work they're doing, a very good work they are doing. Because can you imagine the number of people who have been, dying or who have been disabled because of epilepsy? If they had this kind of sensitization, if they had this knowledge, it will not be so high. But now, with their work, it's going all around. It's only these small villages that are still yet to be covered. And of course, it's not a day's work. It's a gradual process. And we know we'll overcome it.